So today we are going to have a nutshell view of complex or advanced angioplasty. So normally angioplasty is a treatment where some patients have a blockage in the blood vessels of the heart. So instead of bypass surgery, we are treating the blockages by implanting the stent. So this is called the angioplasty. The angioplasty has got two important variations. So one is the straightforward or simple angioplasty, and another is the complex, advanced or precise angioplasty. So what differentiates it is the nature of the block. So usually the blockage develops because of the slow accumulation of the cholesterol inside the blood vessels of our heart. We have three important blood vessels, and if the blockage exceeds 70%, we will have symptoms, and it cannot be treated only with medicines. So we need either angioplasty, which is the stent treatment, or bypass surgery in certain individuals. This depends upon the location of the block, multiple factors, what is the patient's risk, whether there is any calcium, long-standing disease, diabetes, whether there is any mitral valve lesion. So 4-5 factors will decide whether that particular patient needs either angioplasty or bypass surgery. In a simple, straightforward angioplasty, there is a block which is made up of only cholesterol. So normally we cross the lesion with the wire and then dilate the lesion with a balloon and then implant the stent. Since the cholesterol is a very soft material, this is called the straightforward angioplasty. In 15 to 20% of the individuals, the blockage may happen with calcium accumulation also, which is called the calcified lesion. In certain patients, the blockage will be very hard and it will be 100% total occlusion. We need to use multiple wires, smaller balloons, specific imaging devices. So chronic total occlusion, which is a component of a complex angioplasty. And certain individuals, there will be a bifurcation lesion. So normally the blockage happens at the main vessel, but in certain individuals there will be branching vessel and the blockage will be present in both the main vessel and also in the branch. So it is called a bifurcation lesion. And in certain individuals, the blockage will be present in the left main stem, which is called the root vessel. Normally, if the left main lesion is there, we normally advise bypass surgery. But if the patient has certain risk factors for bypass surgery, we will be doing the left main angioplasty. So these are all the conditions which comes under the component of complex advanced angioplasty treatment. The important thing is the expertise. Second thing is we will be using a lot of tools or devices specifically for these lesions. For example, in calcified lesion, to break the calcium, we will be using devices called atherectomy devices. So there are 4 ways of blocking calcium modification treatment. Traditionally, we used to break the calcium using a device called rotational atherectomy, which is a device diamond coated burr, 1.25 millimeters to 1.75 millimeters in size. It will go inside the blood vessel, rotate 180 times to 2 lakh times, and the calcium will be cut into smaller pieces. That will be less than 7 to 8 microns, which will be less than the size of the RBCs. So these calcium fragments will be cleared by the reticuloendothelial system. So after the calcium is broken, we can do the routine balloon and implant the stent. So this is called rotational atherectomy. The second device, which is available now for the last 2 to 3 years, is called orbital atherectomy. So this is a newer device which rotates in 2 directions, like the Earth rotating on its own axis and then rotating, orbiting around the sun. It has got 2 rotations. It can have a bigger lumen gain in certain subset of calcified lesions. So this is called orbital atherectomy. Third is laser atherectomy, which is increasingly used in instant restenosis. When you implant a stent, 4 to 5% of the individuals can develop blockages inside the stent because of the growth of the tissue. This tissue can be vaporized by using the laser catheter, which is called the laser atherectomy. Sometimes calcified lesions can also be broken with the laser atherectomy. And then the fourth important treatment is called intravascular shockwave lithotripsy. This is called shockwave treatment. Traditionally, the lithotripsy treatment is used for renal stones, where the shock waves will break the stones into smaller fragments. Now, the same treatment is available in coronary arteries also, where we can break the calcium. So these are the 4 important ways of modifying the calcium. Sometimes we will be using the additional tool called the cutting balloon angioplasty. So in calcified lesions, we have to use a specific tool to break the calcium and then implant the stent. In bifurcation lesion, there are different techniques, 2 stent techniques, single stent technique, where we will be using, most importantly, imaging devices. So there are 2 types of imaging, which is called intracoronary imaging. One is called intravascular ultrasound, another is called optical coherence tomography, which is called OCT. So just like we do the ultrasound for looking at the liver, kidneys and abdomen, we can use the ultrasound to go into the blood vessel. This is the smallest fine-tuned ultrasound which goes inside the blood vessels of the heart, and we can know the block characteristics. OCT is another mode where there is an infrared light emittance, and this will be getting reflected from the blood vessel walls, and we can get the nature of the blockages. These two imaging devices will help us in implanting the stent properly, make sure the stents are opposed to the wall, and get the precision or fine-tuned angioplasty, looking inside the blood vessels of the heart. This will be specifically used in all complex angioplasties, and we also do left main angioplasty where the left main stem itself is blocked. So here the important thing is to make sure the stent characteristics, block characteristics are coinciding, and we should get the best stent expansion so that restenosis is very less. The fourth complex angioplasty component will be called chronic total occlusion, where the patient slowly get a 100% block. Since it's a very long standing blockage, it will be very hard. So we need to use specific harder wires to cross the lesion. We will be spending most of the time, and then slowly with using smaller balloons, specific CTO balloon, the vessel will be open, and then the stent will be implanted. The other important category is patients are very old, have a blockages, and the pumping function of the heart is very low. Normally the pumping function is 55% to 75%, but slowly the patients will be losing the pumping function. So the pumping function will be around 25% to 30%. Here during the angioplasty itself, the patients can develop a cardiac arrest, which will be life-threatening. Make sure that this cardiac arrest part is taken care of. There is a specific device called impeller device, which is basically a pump-like axial flow device, which pumps the blood out of the heart. Even if there is a cardiac arrest, at that time it can manage, so patients will not be having any life-threatening issue. Angioplasty is done with impeller device. It is called protected angioplasty, where protection is there for the cardiac output so that patients don't get into problems. This is specifically indicated when the pumping function is too low, so that we will manage the patients. After the treatment with the angioplasty, this pumping function slowly improves over a period of 3 to 4 months. Once the angioplasty is over, this impeller device will be taken out of the heart. So this is another way of complex advanced angioplasty, which is called the protected angioplasty.